With the resurgence of COVID-19 in our area, I had the opportunity last Thursday to sit down and talk with Dr. Robert Freelove about COVID-19's impact and COVID-19 testing. Dr. Freelove, thank you so much for joining me.
Sure.
I wanted to have you in to kind of give an update on how the hospital is dealing with the influx of COVID-19 and COVID-19 here in Salina.
Sure. Well, we're seeing an increase in hospitalizations,
Right.
Unfortunately, here at Salina Regional. Patients with COVID-19, confirmed COVID-19. That's been over the last really week or two that we've seen the increase in hospitalizations. That's a direct reflection of what's going on in the community. We've had a dramatic increase in cases in Salina and in Saline County here over the last probably 3 weeks or so. I believe we were 190 cases yesterday. I wouldn't be surprised if we were over 200 by the end of the day, and certainly will be by the end of the week. And this is a disease of momentum and numbers. Once it gains momentum, it spreads. The more people who get it, the more likely you are to have hospitalizations. And while we haven't had another death yet, I would anticipate that we will. Unfortunately, it's like I said, it's kind of a numbers game, and the more numbers you have, the more likely you are to have sick people. The more likely you are to have really sick people, the more likely you are to have deaths.
Okay. Talking about those numbers, let's talk about testing. I know that's one comment that I get from people out in the community is regarding the testing for COVID. So why don't you share your experience with that?
Yeah, I know a lot of people are saying that the increase in numbers is just a reflection of the increase in testing. And I would say that the opposite is true. It's not. We're not seeing more numbers because we're testing more. We're testing more because we're seeing more numbers, especially at least here in Salina and Saline County. We primarily are still testing people who are symptomatic. We are at times testing some people who are asymptomatic. That's generally been in instances where it's part of an investigation of an outbreak or a cluster of cases in one setting. Occasionally we'll test an asymptomatic person who's a known close contact of somebody who has tested positive. If there are risk factors, if they're immunocompromised or if they live with somebody who is. But in general, the majority of the people that we're testing are symptomatic. And so we're seeing more people with symptoms of COVID. And this time around, it seems to be that it's people with COVID, not just symptomatic of COVID, but actually symptomatic with COVID. So the testing, at least here in Salina, really is a function of the fact that the disease is more prevalent now, and that was to be expected when the lockdown came off and we opened things back up and people started to interact, and so we kind of knew that would happen. But really, what we really need to focus on is controlling that spread. I'm not saying we should lock down again, but there are some things that we can do. The masking ordinance, wearing masks, has been shown to slow the spread.
Which we took ours off as soon as we sat down here to talk.
We did, but
this distance.
The other thing that has been shown is social distancing, is maintaining distance. And as long as you can do that, that and masking have a cumulative effect. It's even much more effective. So, and then good hand hygiene. Washing your hands, being meticulous about keeping your hands clean. So those are things that we can do to help control the spread. And that's the goal. That's the goal of masking. That's the goal of social distancing. That's the goal of all of it, is to control the spread. The numbers will be what they'll be. But we need to not have them all at once, because it'll overwhelm the hospital, and then that's when things become problematic. When healthcare resources are scarce, that's when people who are very sick but might survive die, because there's just not enough resources. So it's all about controlling the transmission, and that's what the social interventions are aimed at. So that's why I've been advocating and encouraging patients and talking to doctors to encourage patients to really wear your masks, maintain that social distance, do good hand hygiene to control the spread. there's no doubt it's here. I mean, you don't go from 39 cases to 190 cases in 2.5 weeks because the disease isn't here. It's here. We just need to be careful, be safe, and be respectful, and do the things we can do to control that spread.
Okay. Quick question. At what point in time should somebody get a test? At what are, I mean, I know we've all heard the symptoms,
Sure.
but there's been a couple times with my allergies, maybe had a scratchy throat or whatever.
Mm-hmm.
At what point should they contact their physician?
I would say right now, especially anything that's respiratory, cough, runny nose, sore throat, certainly flu-like symptoms, fever, body aches. We're seeing pretty consistently in people who test positive complaining of either a loss or an alteration in the sense of smell or taste. That's been very prevalent in a lot of the patients that we're testing. And even some GI symptoms, nausea, vomiting, diarrhea. So it's getting kind of broad, the kind of the symptom list of people who maybe should get tested. But I would say if you develop any of those symptoms, you need to contact your primary care physician and talk to them, and they'll do an assessment and work with you to decide if testing is appropriate or not. And then they'll order it, and you'll go get it. Right now, at least through our clinics, and then our stat care and urgent care locations, we're doing our testing, we're doing kind of a drive-up testing to kind of improve safety for everybody.
Right.
We're doing it out behind stat care. Occasionally we'll do it across the street, right there at another location close, but we're doing it outside, and we're batching those so that we kind of can have people drive up and get the test and drive away. I will say, I'm asking for people to be a little bit patient with that. We have had a dramatic increase in the number of tests we're doing. I know Monday we tested almost 60 people. And that's a lot when we're doing that drive up. But that we're trying to make that a little more efficient. But yeah, to go back to your question, if you have any of those symptoms, contact your PCP and work with them, and they'll decide with you whether or not you need to be tested, and if so, they can order it and direct you to the right place.
Okay. Thank you so much. And thank you for watching.